Hello, my name is Megan and I'll be doing my head-to-toe assessment on my sister Bridget. So I would first walk into the room, wash my hands, provide privacy if needed. Then I would introduce myself. Hi, my name is Megan and I'll be your nurse today. I will be completing your head-to-toe assessment. Is that okay with you?
Yes.
Okay. So first I would check her over, just do a basic run-through. Her skin color is normal. She's white, a little sunburned. Her posture is good. She's sitting up straight. She's able to move everything. She walked in here okay. Facial expressions are normal. She's in a good mood, and her hygiene is good. She just took a shower. Okay, so first I would start off with the head, and I would have her smile so I can assess her cranial nerve, and her smile's even. And then I would palpate the temporal artery, and I can feel that. And then I would have her open and close her jaw. No popping or clicking, so that's good. And then I would palpate her sinuses. I would do her maxillary. Does that hurt? And then her frontal. Any pain?
Nope.
So her sinuses are good. And then I would move on to her eyes. I would assess her for cranial nerve. I would do assess her visual fields. So we follow my finger. Good. She has good convergence, so that's good. And then if I had a pen light, which I don't have, I would shine it in her eye. And her pupils constrict good, and they're both the same size. And then I would inspect her external eye structures. They're all normal. Good. And then I would test for pupil size, the same with the pen light. Go in, make sure they're even, which they are. And then we'd move on to the ears. I would inspect the external ear on both sides, the auricle and the tragus, and it's all normal. And then I would move her auricles and push on her tragus to see if there's any pain. Any pain?
Nope.
So that's good. And then if I had an otoscope, which I don't have, I would put it in her ear and gently pull back. And I would look for any waxy buildup, any redness, any signs of inflammation, which there's not. And then I would test her hearing, which is obviously good. She's able to hear me okay. Then I move on to the nose. There's no lesions. Her nose is even. No signs of a previous break or fracture. And then I would have to test the patency of each nostril, so I would occlude one, sniff, then do the other side. And they're good. She's able to breathe out both sides. And then I would just use the otoscope again to look in her nose, see if there's any swelling, any polyps, redness. There's not, so that's good. And then we would move to the mouth and the throat. With the pen light, I would inspect the mouth. Open your mouth. Stick out your tongue. Okay, then lift up your tongue so you can look underneath. Good. Say ah.
Ah.
Good. Okay, so her tonsils are all there. No redness, no whiteness. It looks good. Then I would move on to the neck. I'll palpate the cervical lymph nodes. I don't feel them, so that's good. I would palpate the carotid pulse. Can you tilt your neck? Okay, then the other side. Okay, so that's all normal. And then I would assess her trachea, and it's midline, so that's good. And then I would have her lift up her shoulders, and then bring them down. She has good muscle strength. And then I would palpate the thyroid gland. I have to do this behind. Okay. Alright, and it's good. Okay. Then I would move on to the chest, the posterior and lateral. I would inspect the posterior chest. To the back, yeah, sorry. No lesions or bumps, so that looks good. Her skin is good. Her rib cage isn't inflated or anything. That's also good. And then, yep, so no lumps or bumps, no fremitus. And then I would move on to the breast zone. So I would take my stethoscope and I'd have her take a deep breath. Good. Again. One more time. And her lungs are clear, no adventitious breath sounds are noted. And then I would move on to the anterior chest. I would do the same thing, assessing respirations, any bumps, lumps, that kind of thing. No lesions. And then I would auscultate the front of her chest. Just have you take a couple more deep breaths. Once again, her lung sounds are clear. No abnormal lung sounds are noted. I would then move on to her heart. I would ask you to lean forward and exhale briefly. Okay. No heart murmurs are noted. And then I would inspect the pericardium, which I'm not going to have her undress, for any pulsations, which she doesn't have. Mm-hmm. And then I would palpate for any thrill. There is none. And then I would auscultate her apical heart rate for a full minute, which I'm not going to do, but I'll listen anyways. And her heart rate is regular, and it's a good rate and rhythm. No murmurs. All right. Then with the diaphragm of the stethoscope, I would study heart sounds from the apex up to the base, or vice versa. So I'd use this part. Okay. And now we're done with the heart part. So then I'd move on to her abdomen. I'd inspect contour, symmetry, skin characteristics, umbilicus, no abdominal pulsations, so that's good. Then I'd assess the bowel sounds in all 4 quadrants. And she has normal bowel sounds, not hyperactive or hypoactive, so that's good. And then I would use the other part of my stethoscope to auscultate for vascular sounds, such as over the artery and the renal arteries. Okay. And then I would do a light palpitation on her abdomen in all 4 quadrants. She's ticklish. Any pain or tenderness? No. Okay. I'm going to lay down. And then I would do a harder palpitation, leaving if she was complaining of a tender spot, I would leave that for last. And she's not in any pain, so that's good. You can sit back up. Okay, and I would palpate the liver, spleen, and the kidneys. And then I'd move on to the lower extremities. I'm just going to have you dangle both your legs. First, once again, I would inspect symmetry of both legs, any odd skin characteristics, bruises, cuts, lumps, bumps, scars, all that. She does have some scars on her knees. She had an arthroscopic surgery on her knees. So there's that. And then I would palpate her pulses on both legs. First, I would do the popliteal, which is behind the knee. This one's kind of hard to feel. So there's that. And I do it on the other leg. Then I would move down and feel her posterior tibial. Both feet. And then the last pulse is her dorsalis pedis. Okay. And when I'm looking at her legs, I would assess to see if she has any pretibial edema, which she does not. So that's good. And then I would look at her toes. They're all normal. This would be especially important if she was a diabetic. I'd want to look at the bottoms of her feet, see if there's any wounds or ulcers. And there is not. And then I'm just going to have you do some resistance. Can you pull up? Good. All right. And then I'm just going to have you stand up. Okay. And for your neurologic, I'm going to test sensation. See if you can feel it. If it's even, close your eyes. Can you feel that?
Mm-hmm.
Same over here. Can you feel it on both sides?
Yep.
Okay. So that's good. And then I'm going to have you take a walk. First, walk on your heels with me. Good job. Then turn around and walk on your toes. Good. And she has no varicose veins, so that's good. And then I would thank her for letting me do this. Yeah. Thanks, Bridge.
You're welcome, Meg. Nurse Meg.